This morning we're fortunate to have a special speaker, and before we get started, Dr. Walkup, one of our administrative chief residents, has a gift for Dr. Cornwell since she has to leave early to go do to another important assignment. So, Dr. Walkup. Dr. Cornwell, do you want to come up?
Dr. Cornwell, so nice to have you here today. On behalf of the residents of UNC, I'd like to present you with a white owl. The white owl was a symbol of in Greek mythology of wisdom, and it was also a part of the Halstead legend during his time at High Hampton, North Carolina. Our white owl is given to the chief residents as they're rising into their chief year, and at UNC it symbolizes the strength of character to admit your mistakes and the wisdom to learn from those mistakes. It also emphasizes the importance of camaraderie and team spirit, which has become very much a part of our work here at UNC. As residents, we have chosen occasionally to give this to distinguished speakers. The last time we gave out an owl was to Dr. Montebechi, and today we would like to have the pleasure of giving one to you.
Thank you very much.
Thank you very much.
I'm not going to say much except that's a little bit of pressure when they give you the gift before you give the talk, so thank you very much.
Again, it's an opportunity to have a special lecture. Dr. Cornwell will be here for May Day's trauma presentation, and where he'll be after this. But we will have a reception for him after the grand rounds back in 4050 in Burnett Womack. So I'd encourage all the faculty and residents and anyone else here or in the institution who wants to come and speak with Dr. Cornwell more to join us at the reception. Dr. Edward Cornwell was educated at Brown University and at Howard Medical School. He then did his surgical training at LA County USC Medical Center and his surgical critical care training at the Maryland Institute for Emergency Medicine. He then was on the faculty at Howard University for 4 years before being recruited to join the trauma program at LA County for 5 additional years. He then was recruited to be chief of trauma at Johns Hopkins, where he also was on the faculty of the School of Public Health. And he was there for 9 years before last year being named the LaSalle Lafall Chair of Surgery at Howard University in Washington, D.C. Dr. Cornwell has published extensively in many areas of trauma and surgical critical care management of complex injuries. He also has published on socioeconomic issues in trauma care. He has received innumerable teaching awards, including, and then also has been in many leadership positions, including on the board of directors of the American Trauma Society, the president of the Society of Black Academic Surgeons, the chairman of TraumaNet, a program in Maryland, and the president of the surgical section of the National Medical Association. Eddie has constantly taken on a major role in trauma and violence prevention, also in terms of leading sports programs, and in that still an active basketball player. So I couldn't think of a better place to have him come than to speak to us here at the University of North Carolina. And I'd like to have you come join me in welcoming him. Welcome.
Thank you. That's appreciated. Dr. Myers, thank you. Good morning. You know, it's not just lip service when I say this is a special honor to be able to come and share with you again. I was here a little over 2 years ago, spent 2 days during your Zollicoffer lecture, and I have had an opportunity to give talks and share in departments of surgery around the country, but also in medical schools. And I can tell you, I would say Stanford and University of North Carolina has the most thoughtful and serious enterprise with regards to diversity, recruitment, and retention. I say that as just one small piece of the considerations that I went through when I received the invitation. And I'll start out by thanking my friend Harry Marshall, who not only called me with the invitation, but also was scrambling around. Met me late at the airport last night, came in early this morning. It's sometimes risky, you know, when your ambition to give a special talk, to embed a video and audio in your talk exceeds your technical knowledge of computer compatibility. So with thanks to Harry and others on your staff, I think we have this all squared away, because it is something special I want to share with you. It's great, again, to be with Dr. Myers. Whenever I go to the American College of Surgeons, I like to be at a hotel that has an exercise room. You know, the one time you can get exercise when you travel. And there's one particular hotel that has a basketball court, so I like to get out there early in the morning. And there's usually one other surgeon that's out there on the basketball court I can rely on, Dr. Myers. So it's we always have an opportunity to meet when we get a chance to shoot around a little bit in the early mornings when we go to the American College of Surgery. My position as chairman of the Department of Surgery has now been 15 short months, Dr. Myers, and I just want to thank you publicly for your mentoring and counseling. We had some very significant and helpful conversations when I was considering taking that job, and again, you personify through the Trauma Fellowship T32 grant that you have a commitment to trying to increase the numbers of qualified and able trauma, clinical, and other types of researchers through the programs you have. So I'd just like to publicly salute you for that. Dr. Myers continues the tradition of the sort of fellowship that was referred to in the White Owl presentation, because when I was early in my career, the then chair of the Department of Surgery at North Carolina, Dr. George Sheldon, was a person that always sat out in my mind as a personification of the fellowship of surgery. When I went into the college, I received a note from Dr. Sheldon about the college, its fellowship, and what a great thing it was. I received a tie. He came to Howard to give a talk, and every time I would see him at a conference, it'd always be meaningful interaction. My brother, 11 years my junior, a senior medical student who was looking at a number of institutions and came down here, we interviewed here. Dr. Sheldon, as he was recruiting him, actually wrote a letter for him for another institution where he ultimately trained, Emory. So again, publicly, I'd like to acknowledge my high respect and admiration for Dr. Sheldon and all that you've been in American surgery. So how do you put together a talk when you come to a place that's special to you and that incorporates your passion? Surgery, surgical history, training, diversity, and a little bit of sports analogy. That was my challenge, and that's what I've tried to do today. And I chose to entitle the talk, Where Are We? Reflections on Surgical History, Diversity, and the Mission of a Department of Surgery. And I hope I impress upon you that there are some links between our departments and our two parts of the world that you may not have been aware of before. It's always nice to come to an institution that's the reigning national champions. You know, there's always a little bit of goodwill on the campus. And it's not many medical schools that share the campus with the undergraduate school. I find that the undergraduates kind of reflect the pulse of the university. At Hopkins, when they won the national championship in lacrosse, you could be at the hospital, the medical school, and it just didn't feel much different than any other day. But when you come here, I mean, it's palpable excitement. And although my Maryland Terrapins haven't been much of a threat to you over the years, I congratulate you. And so let me start out by talking a little bit about this man who, Dr. Charles Richard Drew, who really, some 59 years after his death, has an impact that really affects the students, the residents, and the faculty at the Howard University College of Medicine. Dr. Drew was born some 105 years ago in Washington, D.C., at a time when there was a public school, Dunbar High School, that was a so-called, they didn't call it this at the time in the 1920s, a magnet school, but it was a school that had a reputation for, even in the 1920s, sending well-educated Negro students to colleges throughout the land. He was a student athlete who went on from there to Amherst College, 1926. An African-American who went to Amherst College where he participated in sports, track, basketball, football, got his BA degree. And interestingly, in 1926 now, so this is a little after the Flexner Report, which somewhat standardized medical education and had the consequence of dramatically decreasing the number of medical schools in this country. And only two of the schools in this country, then a segregated country as we were, only two of the predominantly black medical schools survived, that Howard in Washington, D.C. and Meharry in Nashville, Tennessee. And so since there were only two, you can imagine every qualified Negro pre-medical student of the era would be applying to those schools. So it was extremely competitive, and their admission criteria were extremely inflexible. So Dr. Drew, great scholar, athlete as he was, his 6 English credits from Amherst were too shy of the 8 that you needed to gain admission to Howard University College of Medicine. He was offered a job teaching medical students in microbiology, but he just couldn't be a medical student. So he went to Baltimore, where he was an athletic director and an instructor in biology and chemistry at Morgan State, and then gained admission to McGill University in Canada, where he would get not only his MD, but his Master's of Surgery, having done some research during his time there. Graduate students could run track at McGill University, and there Dr. Drew, right there sitting in front, was a record-holding track star as a medical student. Set records that would last actually for decades. He would end up graduating second in his class in 1933, and the top 5 finishing students would take a writing competition, which Dr. Drew won, and therefore he got the Williams Award, graduating in 1933 from McGill University, and there's his AOA photo there. A fairly broad training. He had internship in pathology and residency in internal medicine, and instructor in pathology when he came home in 1935 to his Freedman's Hospital. This hospital was established in 1868, Freedman's Hospital, following the Civil War, predominantly, and the next year, Howard University, for instruction and treatment of the freed slaves and their descendants. I was born in Freedman's Hospital, the predecessor to Howard University Hospital. And so when his father died, he came home to Washington, D.C., where he's an instructor in pathology, and then embarked on a surgical residency in 1936, 1937, and became an instructor in surgery before an opportunity arose. In 1936, now the Howard's Department of Surgery had started early in the 1900s, but the residency training program started in 1936. They had had 3 white chairs and 1 black chair of surgery up until 1936. In 1936, a Yale-trained surgeon signed a 5-year contract with the plan that at the end of that 5 years, the most qualified Negro surgical academician would become the chair of surgery at Howard University. It was pretty clear by 37, 38 that was going to be Dr. Charles Richard Drew. But 1938, an opportunity through a Rockefeller Fellowship became available to further his research. He had great interest in the research of plasma preservation, fluid and electrolytes, and the pathophysiology and shock. And so he had an opportunity to go to Columbia University to take a research slot in the Department of Surgery of Alan Oldfather Whipple in the lab of Dr. John Scudder. He was assigned to that lab where he pursued that research. It was very productive years. If you think about writing manuscripts, every time you write a manuscript, you've got to actually go to the library, right, to do your search. You can't just sit at your desk and do your search. You got to write and rewrite drafts, right, and actually load it up in the typewriter. So he had some very productive years that led to this description from Dr. Scudder, himself a well-renowned researcher in the field at that time in the 30s, who described Drew as naturally great, a keen intelligence, a disciplined body, uses a lot of superlatives. His flair for organization, his attention to detail, called him a physician who insisted upon adequate controls of experiments, and called him one of the great clinical scientists of the first half of the 20th century. High praise indeed coming from Dr. Scudder, and would lead to a mantra that many at Howard and all across the country that are familiar with Dr. Drew's legend would associate with Dr. Charles Richard Drew. He would say back then, excellence of performance will transcend artificial barriers created by man. Having been a track star at Amherst, where he and his teammate and classmate, Dr. Montague Cobb, the other black on the team, had to stay at different hotels and eat at different restaurants, even in the Northeast at the time. His Montreal years gave him a glimpse into a society that was much more colorblind than America was at the time. And he had adopted this philosophy that that excellence of performance would afford him opportunities that would help us move towards a more complete society. And so, indeed, Dr. Drew would embark on research that would lead to publications and presentations at the American Surgical, but a slot for residency training became available in the surgery program there at Columbia in Dr. Whipple's department. And Dr. Drew was offered that slot, and this was the letter of instruction, just kind of exemplifying that message of excellence of performance. This is in 1938, 1939. This is New York City now. A letter from Dr. will provide meal tickets and uniform. He's not to eat in the dining room with the other residents. 1 year later, on his reappointment job, I don't know if that's great grammar, he's done an outstandingly good job. The residents insist that he eat in the dining room with them. Fairly mundane, but I've thought many times about that letter of instruction as it relates to the mantra of excellence of performance. Now, did those residents just suddenly get morality this year? Well, this is a man, by every description, who was charming, brilliant of wit. It was probably in their best interest to have an opportunity to spend time and even to socialize with Dr. Charles Richard Drew. And yet, 1 year later, they were the ones that insisted that. This is my opportunity to editorialize my own thoughts on diversity. And if you're at an institution, at a majority institution where you're one of the few minorities, you always are on the diversity committee and the admissions committee, and throughout industry. That's not just in medicine. That's the way it is, and I appreciate that. But I also have gotten to the point where I prefer that these committees and these efforts not be a waste of time. I can do a lot more for you and your institution of diversity if I have 2 fewer committee meetings a week, if it's realistic. And so my theme is always, if our goal is about numbers or quotas or white guilt, it's a waste of time. It just doesn't have legs. If the goal is to expand opportunities in order to expose people that aren't exposed to excellence in all its different forms, then we have an opportunity. It's, in other words, the dominant culture has to truly believe it's in their best interest. Has to truly believe it's in their best interest. And so I always look for the sports analogy because, as many of you in the audience, I share a sports passion. And I do see a lot of analogies as it relates. I don't need to come here to talk about the impact on college sports, but I'm old enough to remember a time when college football was bigger in this country than pro football was. Now, I know this is basketball country, but you all well know that, particularly throughout the South, college football has had, over the last century, a major impact on our culture. I pulled this quote from a 1967 issue of Sports Illustrated. Gene Stallings, then the head football coach, a large football program, Texas A&M in the South, and the question about integrating their team came up, and this was his quote: "To accomplish our goals, we all have to fight together, sweat together, and sacrifice together. I don't believe, and be pulling in the same direction, I don't believe we can do that with a Negro on the team." Now, 25 years later, the University of Alabama, with Alabama's history, the University of Alabama was the national champions in NCAA football. They had 11 black starters on defense. And, of course, their head coach, Dr. Gene Stallings. Now, he was 40 when he made that first quote, 65 when he made the second. Did something happen in that quarter century to his own morality, or was it in his best interest to expand the opportunities to be a starter on his defense to all? This is just one example of where societal changes are affected. We see it in other industries before we see it in our own. And many of you know Dr. Organ. His mischievous style could be incorporated in this quote that he used to say: if the dean's having difficulty recruiting black students, residents, or faculty, he should turn that recruitment over to the football or basketball coach. They seem to do quite well. Well, that's my digression about the dominant culture must believe it's in their best interest to expand opportunities. In that case, a football coach gets to win a national championship. I guess you could argue that he still felt that they could only pull together in the same direction if they were all on the same race on the team. Since he had 11 black starters on defense, I guess he could argue that he had the same theme. But Dr. Drew's vision of this was that similarly, in science, in surgery, and in medicine, that excellence of performance would forge opportunities for generations behind him. And you could see that evidence of that even in the late 1930s. His work, his thesis, through his work from his research, was entitled "This Bank Blood, a Study of Problems Associated with Blood Preservation." Now remember where we are now. This great conflict over in Europe is developing. Lots of wartime injuries and a great interest then to be able to take resuscitation to the next level of sophistication by being able to preserve plasma proteins and to transfuse blood and plasma. Think about how many more patients we save in trauma surgery by virtue of having the potential to transfuse their entire blood volume many times over. It takes us from a time when basically survival would be impossible for anyone that's lost half their blood volume. And think about the patients that you've had on your trauma service in your ICU that have lost 2,500 cc's of blood. All those patients heretofore would have what we would have then called lethal injuries, but for the ability to preserve plasma and to transfuse blood. So as I said, it's a very productive time during research for Dr. Drew. 15 publications on shock, fluid, and electrolytes, and plasma preservation. Having taken that leave from Howard, he returns as assistant professor of surgery, had an 8-month period where he came back up to New York to lead the Blood for Britain project, which would be the predecessor to what we now know as the American Red Cross. So he was the leader of that, and as I mentioned, his research led to some landmark papers. He was a co-author of this paper that was presented in 1940 at the American Surgical Association in St. Louis. We don't believe that Dr. Drew was at that meeting if you look at the roster, and it's not clear whether or not he would have been admitted to such a meeting. And so he took that leave in 1941 as the director of the American Red Cross Blood Bank, the assistant director of blood procurement. Now, Dr. Drew could be the director of this blood bank, but in accordance with the policy of the time, he could not donate blood. Negro citizens were not allowed to donate blood, and he was yet very reserved. He would not, in 1941, he did not think, as a war conflict was emerging, that he would be in any position to publicly criticize U.S. policy, but he privately did everything he could at every opportunity to talk to the military brass, to say things such as this in letters that he wrote. There's no scientific basis for the policy, number one. Number two, no government should promote a policy that demoralizes any of its citizens. And number three, and this practicality, I like the practicality. Number three, we need the blood. No scientific basis for the policy. We need the blood. It would be years before it changed. It's not clear if his returning to Howard from that time reflected a resignation and protest. It certainly was no public proclamation of such, but there was no question about his private feelings about that. 1940-41 was also important years for him. Had met and married in the late 30s. His sweetheart, who he had met when he was traveling through the South through Atlanta on the way to Birmingham, Alabama, for a famous surgical clinic that took place at Tuskegee every year. But he also took his written boards in 1940 and had his oral boards in 1941 at Hopkins. Had the oral boards, and much like today, there's examiners in different rooms, and you go from one room to the other and are questioned. And apparently Dr. Finney was the examiner, Dr. Sheldon, and he asked him a question, would you believe it, on the pathophysiology of shock and fluid and electrolytes. Now, the man had done his doctor's in science work, had written his thesis, and this is one of the questions he gets in oral boards. 1941, at a place where many of those people would never have seen a black medical student, and perhaps not many blacks who they have seen in their circle that could read or write. And they ask him this question, and as you might imagine, he starts to wax with in a very erudite fashion. And as it goes, so this is a third-hand information from one of Dr. Drew's residents who was told this story from Dr. Drew, who told me. And Dr. Drew was not a man given to bragging. But as the story goes, the examiner stopped, interrupted Dr. Drew, said, just wait a minute. And he goes to other rooms, knocking on doors, getting other examiners to come in to listen to this answer because he was just that impressed. And Dr. Drew himself would, as you might imagine, pass with flying colors and later become himself an examiner. He became professor and chairman of surgery at Howard University in April 1941, would have many awards, including the NAACP's highest award, the Spingarn Medal, for his research. And his agenda was very transparent. He was interested in training excellent Negro men. That was, speaking of diversity, that's what it was back then. It was all men, giving them the best possible training so they would come to hospitals throughout America and even throughout the South to expand opportunities with that philosophy that he would espouse at every turn. Excellence of performance will transcend artificial barriers created by man. Dr. Drew's death, that I will spend a little bit of time talking about, his untimely death before his 46th birthday, an automobile crash in 1950, was followed by premature deaths of his two successors, the surgical chair, Dr. Richard Lowry, in 1955, who had coronary artery disease, and in 1957, after just 2 years as chair, Dr. Clarence Green, who was the first black board-certified neurosurgeon who would die only 2 years into his chairmanship. And then a turn of fate, 1957 to the present. My entire lifetime, the chairmanship was held by three men who were my professors as a medical student at Howard. And so the first thing, as you might imagine, that I wanted to do, this was just 1 week after I became chairman, was to get an opportunity to have this photo, because this is the first time there's 4 living chairs at Howard University. And I take no credit for that. Obviously, the longevity of Dr. Burke Syphax, who's 98 and a half years old, who still comes to the Drew Syphax lecture. He was chair from 1957 to 1970, a period when clinical excellence and developing many surgeons, kind of our heroes, was the hallmark of that time. And then he was succeeded in 1970 by then a 40-year-old chair, Dr. LaSalle Lafall, who's the Lafall chair, which I now occupy. Dr. Lafall was chair from 1970 and 1996, and Dr. Clive Callender, transplant surgeon, was my immediate successor from 1996 until last year. And so during this time, there becomes an evolution in the mission of this department where the days of best black this or that are long gone, where our focus is we should be a credible source of excellence in clinical and academic productivity, academic excellence in areas, particularly in surgical diseases, where we still see disparities. And that's been the theme that we've developed through our Outcomes Research Center that we've now developed, and in those areas of first-year focus, minimally invasive and bariatric surgery, the morbid obesity epidemic, with disparate disparities of prevalence is now emerging nationally. Surgical oncology, we see the same thing. Trauma, critical care, interpersonal violence, and transplant surgery with end-stage renal disease were all first-year priorities for myself. And the cardiovascular diseases and other subdivisions are areas of focus in this year going forward. And so there's, through Dr. LaFall himself, a student of Dr. Drew, Dr. Syphax himself, who graduated from Howard University College of Medicine in 1936, that year when the surgical residency started. So he was in the first residency class and a faculty member under Dr. Drew. Indeed, he's in this photo right there. That's Dr. Syphax right there. And this is Dr. Syphax right there, faculty member in Dr. Drew's department. Really deserve a lot of credit for maintaining that legacy. I want to highlight one other person who was a resident of Dr. Drew's during his short tenure, 1941 to 1950, as chairman of the Department of Surgery. Dr. Asa Yancey, born and raised in Atlanta, Georgia, got his undergraduate degree in Morehouse. And there were, despite the fact that 95+% of black medical students at the time, in the 40s, went to Howard or Meharry, University of Michigan class of 1941 had 4 black members. Dr. Asa Yancey was one of them. He did an internship in Cleveland, and then he went to Freedman's Hospital, which is certainly during this time one of the desired internships for someone of Dr. Yancey's race. He trained there. You could get your training done in about 2 years during that wartime conflict, and he spent an additional year at the U.S. Marine Hospital in Boston, Massachusetts. But because Howard, then Freedman's Hospital, had a fairly mature OBGYN department, he didn't have as much experience in pelvic surgery as he wanted. And so he went to Meharry, where he got further experience in pelvic and GYN surgery and pursued his interest in this disease of congenital megacolon and the aganglionosis that led to that problem. When Dr. Drew was, again, very clear in his goals for Dr. Yancey, he wanted Dr. Yancey, a native Georgian, to return to Atlanta at a time when Grady Hospital there and Emory looked like it might be receptive to integrating. And Dr. Drew saw Asa Yancey as the person, through his temperament, his performance, and his research excellence, to be that person. Dr. Drew was instrumental when an opportunity in 1948 opened up for chief of surgery at Tuskegee in procuring that job for Dr. Yancey. And Dr. Drew would never live to see his dream come true. Dr. Yancey would have that position for 10 years before he would return to Emory, where he would integrate Grady Hospital and the surgical faculty at Emory, and indeed would become the first black member of the Southern Surgical Association. Dr. Yancey's research in the dog lab led to as others were doing, consideration of modifying the operation that was done for megacolon, actually preserving, stripping the seromuscular sleeve of the denervated rectum, preserving that and performing a rectal anal anastomosis. And this in this article, this depiction from an article that he had done in dogs and had done in a patient when he was at Tuskegee, demonstrates that anastomosis here, pulling the rectal sigmoid down through the seromuscular sleeve and performing that colo-anal anastomosis right there in the perineum. And he wrote that up, a modification. He did it on a patient who survived the operation. The patient would live several months, but sadly would die later on when she came back from an adhesive small bowel obstruction with gangrene. But that patient survived. And Dr. Yancey wrote that up in the 1952, the Journal of the National Medical Association. Now, this journal was not in the library of most majority medical schools, but this article, A Modification of the Swenson Technique for Congenital Megacolon, as I said, it was published then, some 12 years before Dr. Suave described a technique that we now call today the Suave procedure. 12 years before Dr. Yancey had written that and published in the Journal of the National Medical Association. I learned a lot of this when I had the opportunity to pursue a surgical history grant that the Southern Surgical gives, and had an opportunity to spend a couple days interviewing Dr. Yancey. Again, a very reserved, modest Southern gentleman who's in his 90s, very sharp to this day. He doesn't travel much. His wife is not well, but it was just a sheer pleasure to have an opportunity to talk to Dr. Yancey. There was a co-author on that paper, Dr. John Ford, just to show you some of the links in our surgical history. Dr. John Ford, born and raised in Illinois, went to a Seventh-day Adventist college and went to Loma Linda University. So he was in the class of 48 as the only black student at Loma Linda University. And Loma Linda used as their teaching hospital, Dr. Myers, Los Angeles County Hospital. So when I got to LA County to do my internship in 1982, I knew that there were two blacks before me that had completed the program and one that was in the program. And that's all I knew. I did not know anything about Dr. John Ford. Dr. John Ford, in fact, had done an internship at Los Angeles County Hospital 1 year, and then he came to Freedman's Hospital to get further training at Freedman's. That would become important because Dr. Ford would be in the automobile in April 1st, 1950, when Dr. Drew was taking him with him down to Tuskegee to try to pursue further training opportunities for Dr. John Ford. Let me elaborate on that link. So, March 31st, 1950, the last complete day of Dr. Drew's life. This was his day. Dr. LaFall went back and put back together his entire itinerary for that day. He made rounds with the residents at 6:30 in the morning, did a radical mastectomy at 8 o'clock, and gave a lecture, as he did, to the second medical students. This was his third and final lecture that he gave of a series of lectures he would give to the sophomore medical students in there on guess what, shock, blood plasma, and water balance in the course that they took in their preclinical year entitled Introduction to Surgery. So this was March 31st, 1950, so this was the class of 52 where he's giving this talk. And sitting in the front row, as he always did, would be the student that would finish number one in that class of 52, a 19-year-old sophomore medical student. That's right, a 19-year-old sophomore medical student, Dr. LaSalle LaFall, sitting right there in the front row in what would be Dr. Drew's final lecture. He would have lunch. He would be back in his office doing Department of Surgery business, home for dinner with the family. The prior year, 1949, he had received awards from both the nursing sorority and from the student council there, and so he came back to both of those organizations to speak to the nursing sorority from 7 to 8 and the student council banquet. Pretty busy day. And guess what he did after that? No 40, 80-hour work regulations. Rounds, I'm sure the residents were with him, 10 to 11 at the hospital. Then he went home to pack. So his plan is to come to the Tuskegee Clinic in Alabama. But in 1950, Interstate 95, there were no interstate systems. So you had to be careful traveling through the South where you were going to go. So Dr. Drew and another faculty member, Dr. Sam Bullock, and these two young residents, John Ford, who I mentioned, and an orthopedic surgery resident, Walter Johnson, who was going to present at that clinic, were all in the car, leaving early morning, 1 a.m. Their plan was to go to Atlanta, where they would stop at a YMCA, change, clean up, and then go from Atlanta to Tuskegee. That was their plan. And they left around 1 o'clock in the morning. Pretty busy day, not the best circumstances under which to embark on the trip. Dr. Bullock's 1949 Buick Roadmaster, this is not the Roadmaster, but I leave this just to depict that after about five hours there in North Carolina, and Dr. Drew takes the wheel and is not driving for much more than an hour when he falls asleep at the wheel. Dr. Drew was driving. Dr. Sam Bullock was in the front passenger seat, and the two young surgical residents were in the back seat. Now, Dr. John Ford, in his late 80s, still very sharp. He remembers this day like it was yesterday. I flew to Cardiff by the Sea, California, just north of San Diego, spent an afternoon with Dr. Ford. And as he states, Dr. Drew had fallen asleep, and Dr. Bullock said, "Charlie, watch out." Dr. Drew woke up and made an abrupt corrective maneuver that led to the car losing control, and the car ultimately flipped over. The two young surgical residents were thrown from the back of the car. Dr. Bullock was later found wedged under the dash, and Dr. Drew, whose left foot was caught under the brake pedal, was somewhat stuck in, and his head and upper body was halfway out of the car as the car flipped over, ultimately landing upright. But as the car flipped over, the bulk of the weight came down on Dr. Drew's head and chest and upper body. So Dr. Ford sustained fractured the surgical neck of the humerus. Dr. Johnson was relatively uninjured, as Dr. Bullock was, and Dr. Ford is the only surviving member 59 years later who was in that car on April 1st, 1950. I go through the timeline in some detail because of a myth that had survived for many decades about the treatment of Dr. Drew. He was, the accident was sometime before 8 in the morning, taken to Alamance County Hospital in Burlington, North Carolina. Interesting, that county was known for having very fair-skinned blacks of the time. And so here's Dr. Drew on the roadside, and you see his photo. And when he comes to Alamance County Hospital, some of the ER physicians, in fact, a couple of the surgeons working there, knew of the national prominence of their patient. He did not survive the resuscitation, critically injured, did not survive the resuscitation efforts and was pronounced dead shortly after 10 o'clock in the morning. And so for this, in addition to researching the books and having an opportunity to talk to Dr. Drew's daughter, Dr. Charlene Drew Jarvis, who is president of a law school in the District of Columbia and was a former city council member for many years in District of Columbia, has remained closely affiliated with Howard. I interviewed Dr. LaFall on tape because he tells this story. I've heard him tell it hundreds of times. Dr. Ford and Dr. Yancey, Dr. Drew's former student, his former resident, and his former faculty member. And they all, share similar plaudits and hyperbole about their thorough admiration for Dr. Drew. But it's tough to capture the impact of losing this prominent member on that university, Howard University, and in that College of Medicine. And so I thought I'd share with you through this audio, again, thanks to the help that I received to make this work, the impact that it had on that young medical student who was sitting there in the front row in the last lecture that Dr. Drew ever gave.
Car crash. Students don't have class at Howard on Saturday night, medical school, but when I was a second-year student, we had class on Saturday. And I can remember very well we were having class in the medical school. Dr. Walter Booker, professor of pharmacology, was lecturing to us. And I used to always sit on the front row because I didn't want to miss anything. I'm sitting on the front just writing all these notes. And a person came in, I think it was somebody we call Long Tall Miller. Miller was about 6'4", that was Long Tall Miller, a laboratory technician in the Department of Pharmacology. And he whispered something to Dr. Booker. I couldn't hear what he said. I'm on the front row, but I still couldn't hear what he said. But Dr. Booker's face turned ashen. And he then turned to Miller and said this: "You shouldn't joke like that on April Fool's Day." And I can always remember that because it was April 1st, 1950. I was a sophomore medical student. He said, "You shouldn't joke like that on April Fool's Day." And what did Miller say? He said, "Oh, I wouldn't joke like that." In other words, you might think about saying something about you left the lights on and all that, but you're not going to say the chief of surgery was killed in an automobile accident. So Dr. Booker then turned to us and said, "I have some very sad news for you. Our chief of surgery was just killed in a tragic automobile accident just outside Burlington, North Carolina, on his way to a medical surgical meeting in Tuskegee, Alabama. Class is dismissed." It was just hard to describe the way we felt. This man was so big, we wondered if the medical school would survive. Now, we know full well that no one person is bigger than any institution. We know that. But still, he cast such a giant shadow, such a big shadow, that we were wondering, could the medical school survive? Well, obviously, it did survive, but that's how we felt, just totally saddened. And how could this be? And that was it. A Saturday morning, April 1st, 1950, in a class in pharmacology, being lectured by Dr. Walter Booker.
Dr. LaFall remains the living link, really, between Dr. Drew and medical students to this day. Just last week, he was again named one of the honored faculty to share that photo in that class of '09 for those medical students. Continues to lecture and continues to be a favorite of medical students. And I've heard that myself as a student, as a junior faculty member. You shouldn't joke that way on April Fool's Day. I can always remember the date myself, April 1st, 1950, because of that. Dr. LaFall also has been one of the leaders in trying to dispel a myth over the decades that has persisted about the resuscitation and the efforts made on Dr. Drew's behalf. Transported to this hospital, to be sure, a segregated hospital, but black and white patients were all received in the same emergency care area. It was treated by an orthopedic surgeon, the Cornwell brothers, Duke-trained surgeons. I guess I shouldn't have said that. Duke-trained surgeons who were working in that emergency department. A urologist, another general surgeon, all worked on him. And Lucille Crabtree, a nurse anesthetist, who actually intubated intubated Dr. Drew. Dr. LaFall would go down some 30-plus years later to that hospital where Miss Crabtree still worked. She wasn't there at the time, but weeks later she came and visited family in Washington, D.C., and sat with Dr. LaFall and told him the whole story. Again, imagine remembering that 30 years later, the impact that had on her own life. There was no such thing as an injury severity score, Dr. Marshall, at that time, but if there was one, Dr. Drew, even in today's trauma systems with improved survival, would have had what you would call a lethal injury, a severe closed head injury. Pupils were fixed and dilated, a crush injury to the chest, traumatic asphyxia, avulsion injuries. His cause of death was signed out as brain injury, internal hemorrhage of the lung, and multiple extremity injuries. You can find his, in 1968 in Time magazine, which commemorated a stamp that was created on Dr. Drew's behalf, this article. Dr. Drew pioneered in new techniques to store blood plasma. Ironically, bled to death after he was injured in a car crash and was turned away by an all-white hospital. Time magazine, 1968. An episode of MASH referred to Dr. Drew not being admitted to this hospital. And it's hard to figure it out, but I think that if you go back to the definitive work on Dr. Drew's life, with the foreword by a famous historian down in these parts who you all know recently died this year, Dr. John Hope Franklin, Spency Love's work is the definitive work on Dr. Drew's life and death. And on this front page, on this front cover, is Alpheus Mavry, a 24-year-old at the time of his death, veteran and a student at North Carolina A&T, who on December 1st, 1950, 8 months to the day after Dr. Drew's death, was involved in a auto crash, single car crash, severe head injury, taken to Alamance County Hospital, actually was not as unstable as Dr. Drew was, and so was transported, hopefully, to Duke, where they could take care of head injuries. But Duke's 12 Negro bed allotment had been filled, and so he was actually not admitted to Duke. He was admitted to a smaller hospital in Durham, where he died. The actual true story of Alpheus Mavry, some people think, certainly Spency Love, her thesis is that the true story of Alpheus Mavry over the years has merged with the myth of the famous patient, Dr. Drew, and somehow came together. You could find newspapers at the years later, black newspapers that talked about Dr. Drew being denied care. And yet, Mrs. Drew sent a letter to the people at Alamance County Hospital thanking them for their efforts on behalf of Dr. Drew. Again, Dr. LaFall articulates it better than I could, so I thought I would share with you a video from my determination to record Dr. LaFall's thoughts on this.
And going there, I found out that when Dr. Drew was brought in, that they knew that he was coming. But I should mention this, because when I was there was a lady who was a nurse anesthetist, Miss Lucille Crabtree. She was not there when I went down there in April. And she said, but Dr. LaFall, I'm coming up next month with my son, his wife, and my grandson. I'll be happy to talk with you then. So if I can jump to that, that lets you know what happened then. She said, we only ran one room on Saturday. And I had a patient on the table. I was getting ready to give my patient some Pentothal, and then I was going to put in a tube for the operation we were going to do. They called from downstairs and said, there's been a very bad accident out by Hall River. They're bringing in some patients. One of them is critically injured. And she said, I am so glad I hadn't given my patient on the operating room table some Pentothal, because I could not leave a patient whose life I have placed in jeopardy by giving him some Pentothal, something that decreases respirations, and go to a patient whose life is in jeopardy. But I hadn't given anything. So she said, I put my endotracheal tube and my laryngoscope in my pocket. I ran downstairs. And when Dr. Drew came in, I was downstairs waiting along with other people who were there. She described this to me. She said that his pupils were dilated, both. There was blood coming from his ears. He had a crush wound of his chest and an avulsion wound of his thigh. And she said he was breathing in a very shallow manner, very shallow. And she said he was in deep shock and his blood pressure was in the low numbers. And she thought it was in the range of the 60s. And I'm going to mention something about his record in a moment. So she said then what she did, she got an endotracheal tube, a laryngoscope, put the endotracheal tube in, and she said, Dr. LaFall, we were all sitting down, she said, not a bragging eye, but a sincere, thoughtful, genuine eye. She said, I was with him from the time he arrived until the time he died. I put the endotracheal tube in. I gave him IV fluids. Not that I was the only one there. Other people were there too, but we cared genuinely about him. And we were thinking about transferring him to Duke, only because Duke is a university. Alamance General Hospital is a little hospital. But we didn't have the time to get him there. His condition did not allow us to transfer him to Duke. I then asked her, did he get any plasma or blood? And she said he did receive plasma, but they didn't have blood then. She said, Dr. Fall, we were a little hospital. We didn't have blood at that time, and by the time blood was available, he was dead. And I often mention this when I tell that story. I am so glad that I was sitting down, because to look into this woman's eyes, to know she was telling the truth, you just felt it. You knew she was telling the truth. And to hear what she had to say, I got weak in the knees. Just sitting down, I got weak in the knees, so I'm glad I was sitting down. We wanted to save this man's life if we could. And I believed her. I still believe her.
The thing I like about that story is the other thing that's important to us as surgeons, integrity. How easy it would be, how convenient a story. It'd be an easy story. You could imagine the Hollywood script, right? Dr. Charles Drew, who pioneered all this, is turned away. Except it wasn't true. It wasn't true. And Dr. LaFall talks about throughout the 70s, in a period of activism, he'd have medical students who would respectfully say, if you could respectfully say such a thing, why don't you shut up, Dr. LaFall? You know, it was segregated. They just let them take the hit. He said we would be no better if we would allow such a story to persist on behalf of those people that did everything they could to save Dr. Drew's life. And so you see Dr. Drew, this is Charlene Drew Jarvis, his daughter, at a meeting. There's Dr. Syfax there, Dr. Organ, who himself was, as in one of the lectures that he gave, among the others that tried to help dispel the myth about Dr. Drew's death in a presidential address that Dr. Organ gave. The National Medical Association journal that I mentioned, where Dr. Yancey had published his paper on the pull-through procedure, has had 3 separate editors who have all talked about the facts, the fiction, and the legend of Dr. Drew's life and his death, again, trying to dispel the myth. So I would conclude in these remarks about evolution of a department, about diversity, and about the things that are special to us as surgeons, that the measure of Dr. Drew's impacts and contribution go far beyond his enormous accomplishment. It still affects me, a man who died several years before I was born, but that his impact can be traced through the contributions of a generation of surgical scientists, inspired not only by his insistence on excellence of performance, but also his dogged belief that the practice and ethics of surgery should be guided by principles of compassion and integrity, even when inconvenient and not supported by popular myth, and carried on to this day through the lives of the still living, his former student, his former intern, and his former resident. And so I leave you with where we began, that I still believe that excellence of performance will transcend artificial barriers created by man. And I thank you for your attention, and thank you for the invitation.
I'd like to thank Dr. Cornwell for the inspired presentation. give him a Carolina tie that he may have one of several in his collection. And I do have a UNC championship T-shirt that he can wear the next time he's at the college out exercising.
I thought he was going to brag and say I may have several of those too, because in 1982, 1990.
We can go back and see if we can find some.
Okay.
Thank you very much.
Thank you very much.
And now